Hello everyone, welcome to the channel Knowledge. Today I come up with a very important topic regarding a disorder named as diabetes mellitus. It is the mother of all diseases present in human body. Now, what happens in diabetes mellitus? Diabetes mellitus, before I tell you about diabetes mellitus, let me clear your concept that about a gland that's present in our body, that is pancreas. It's a loop-shaped gland present just beneath the stomach. It is few cells in it, like beta cells, gamma cells, delta cells, and so on. Now, the diabetes mellitus is concerned with the beta cells. Beta cells releases insulin. Now put this in your mind, I will tell you later. Now, diabetes mellitus, what happens is, this disease is concerned with the insulin, because the insulin is imbalanced in our body. This is not a disease, this is a disorder. In this disorder, the insulin is imbalanced in our body. Now, in diabetes is many types, but I'll tell you about the two main types that are very, very important. Now, these are the differences of diabetes type 1 and diabetes type 2. Now, what happens in diabetes type 1? See, in diabetes type 1, there is destruction. Remember this word. This is destruction of beta cells. When there is destruction of beta cells, the insulin is not released by the pancreas, because the beta cells, as I told you before, that beta cells are responsible to secrete insulin. Now, what happens in diabetes type 1? There is destruction of beta cells. When there is destruction of beta cells, that individual is always dependent on insulin. Insulin dependence is for always, for lifetime. Now, people ask that what is the proper, exact age that people suffer from diabetes type 1. Now, age is mostly below 30 years. The people sometimes are born with diabetes, that can be genetic, because diabetes can run in families as well. Now, people who are below 30 years are mostly suffer from diabetes type 1. Now, glucose intolerance is severe. Now, see, what is glucose? Glucose is sugar that we are taking in our diet. When we take glucose is always balanced and maintained by that insulin. When the insulin is not present, the severity increases in body, because the glucose is not balanced by the insulin, because insulin is not present in type 1. Now, these are the clinical symptoms that tell you that you have diabetes, like polydipsia and polyuria. That means you go to washroom many times. Whenever you take water, whatever, you get the urge of passing urine. This is a clinical symptom type 1. And polyphagia, like you are very hungry all the time. And these are the clinical symptoms. You have to remember the 3 P's: polydipsia, polyuria, polyphagia. These 3 clinical symptoms define type 1. Now, see the type 2. Now, what happens in type 2? The beta cells are intact, beta cells are present, insulin is released, but there is resistance to uptake of insulin. Insulin is not taken up by the cells. Now, this is type 2. Insulin is being released by beta cells, but insulin is not being taken up by the cells due to high resistance. Remember this point. Now, insulin dependency, it is sometimes. And the patient is not always dependent on insulin. Patient can be given some drugs, hypoglycemic drugs, like they are present, metformin. These are very common nowadays. Now, age, because the type 2 diabetic people are more older, after 40 years of age. It's most common in obese people, the people whose BMI or body mass index are more than 30. Now, glucose intolerance is not that much. a person like doesn't suffer from glucose intolerance. Type 2 diabetic people can take glucose and carbohydrates and sugar in their diet because the symptoms are mild to moderate. Now the clinical symptoms, these symptoms are sometimes present and sometimes not present. Now I hope it helped you to differentiate between between type 1 diabetes and type 2 diabetes, and I hope I clear your concept about what diabetes is really. Thank you for watching this video tutorial. Please don't forget to subscribe for more such knowledgeable videos. Thank you.